Dr. Kim, can you please introduce yourself to our viewers?
Good day. I'm the Representative Director of Sun Plastic Surgery, Specialist Dr. Kim Sun Dong.
So, Dr. Kim, today we'll be talking about upper eyelid surgery first. So, what is exactly upper eyelid surgery?
What is a blepharoplasty? Usually, with age, upper eyelids become droopy, and by removing them, we create double eyelids, and that is blepharoplasty.
Okay. So, usually what causes droopy eyes?
There are two reasons as to why a person's eyelids start drooping. First, as a person starts aging, their skin becomes less and less elastic, causing it to sag. Another thing to note is that it's not just the eyelids, but the eyebrows as well. Yes, eyebrows sag as we get older, and as they droop, the eyelids follow suit. On that note, the elasticity of the eyelid itself decreases, eventually causing the skin to sag and become droopy. And that's pretty much it.
Then, doctor, for whom do you usually recommend this kind of surgery?
Blepharoplasty is usually recommended for people with droopy eyelids. Having droopy eyelids usually makes a person look older than they should, and it's hard to keep your eyes open due to saggy skin and constantly raising your eyebrows. Another reason as to why is that the older one gets, the eyelids may droop and rub against the skin, causing irritation. I recommend blepharoplasty for people like that.
So, how is this surgery performed? How do you perform this surgery?
For blepharoplasty, we usually remove the skin. The most important thing is how much skin resection is done in the surgery. You need to have a moderate amount of skin resection to make the right double eyelids. And another important thing, usually people who have gotten blepharoplasty have a droopy eyelid on the outside. When the outer part is droopy, it is often difficult to maintain or make double eyelids. So, if there's someone who has gotten blepharoplasty and has droopy outside skin, most of them have less double eyelids on the outside. For the process of blepharoplasty, as mentioned earlier, first off, how much skin resection is done, and second, how well can one make the double eyelids on the outside. These are the two most important parts when getting a blepharoplasty.
Okay, so let's talk about the recovery process. So the patient after the surgery, what should he or she do?
There really isn't anything special when it comes to post-operative care. It's just similar to general post-operative care. Usually, it's applying ointments and putting heat pressure. My recommendation is starting with cold pressure and switching to warm after 2 to 3 days.
Before the surgery, what should the patient be precautious about?
Before getting a blepharoplasty, be aware of what medication you're taking. Blepharoplasty is usually done on older patients, and it's safe to assume that these kinds of patients are taking some sort of medication. Aspirin seems to be the most common, and these patients tend to take other supplements as well. These kinds of medications cause them to bleed easier. I advise patients to stop taking these kinds of supplements a week before the procedure, especially those who take aspirin. They're taking it for a reason, so they should run it by their family doctors on whether they're allowed to pause on taking these medications. If they get the doctor's confirmation and stop taking aspirin or similar medication for at least a week, then the surgery can go ahead.
Okay, so last question regarding the subject. What are the side effects of upper eyelid surgery?
For side effects with blepharoplasty, since it is a cosmetic surgery, dissatisfaction with the shape or outcome can happen. Of course, this is entirely preventable as we can design the shape before the surgery. Another common side effect is bleeding, but that doesn't often happen. We do have to let you know a few things before the surgery though. As mentioned before, as eyelids sag, one tends to lift their brows to keep their eyes open. But through the surgery, one can relax their brows as it gets more comfortable. If then, the wrinkles on the nose get worse. The gap between the eyebrows and eyes get narrower, making the eyes seem smaller than they are. So in this case, we suggest a forehead lifting surgery to make up for the sagged eyelids. Before the surgery, we check whether the sagged eyelids can be lifted through blepharoplasty or forehead lifting surgery. We deliberate between various factors and then proceed with the chosen operation. Today, we learned about blepharoplasty. I hope this video has given help to those who are considering about taking the surgery. Thank you.